Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we will be having Dr. Arun Garg from Canada India Network Society and George Abbott, former minister, who has also written a book about Big Promises, Small Government is the heading of the book. And our focus will be about his experience as a former health minister and education minister as to what he feels, why prevention is important in today's lifestyle, what we are adopting, and how we can have better health. So this is a part of series of the programs what we have every month in which Canada India Network Society and the Harpreet Singh Show collaborate, and we have a special guest, and it's a great honor to have Mr. George Abbott today with us. Let's welcome both the guests and continue with our discussion. Mr. Abbott and Mr. Garg, welcome to the program.
A pleasure. Very happy to be here. It's always, I look forward for these, I'm becoming addicted to see you.
And, people are also getting addicted because we get a lot of calls and emails saying that when are we having that collaborative program. Anyways, thank you, both of you. So, Mr. Garg, I would request you to please introduce our honorable guest today.
Yeah, it's a pleasure. We have a very special guest today who is a friend of the community, friend of our society, and a personal friend. I've known George for a few years now. He is a doctorate. He just finished his PhD, as a matter of fact, and the book refers that. So it's fair to address George as Dr. George or Dr. George Abbott. Right. George is a public policy consultant and president of Circle Square Solutions Limited. Currently, my association with him was on Institute of Health System Transformation and Sustainability. This is a think tank which was formed a few years ago, healthcare, and we will touch on some of the facets of that sustainability of healthcare. And George is a real expert. And as you mentioned in your introduction, George was active in public service, public life. He was member of Legislative Assembly for Shuswap and for 12 years as a cabinet minister. Quite a contribution to the society. Among his portfolios, he had health, education, Aboriginal relations and reconciliation, sustainable resource management and communities, and women's services. So Harpreet, we are very fortunate and we're delighted to have George as our guest for the show.
Absolutely, there's no doubt. It's a great honor to have him today on the show, and from his experience, from his wisdom, from his knowledge, we're going to learn a lot of things, and especially as far as healthcare is concerned. So, Mr. Abbott, you have a wide experience in the government field as well as in the private sector also. So we would like to start off with the crisis in which we are today. It's a health crisis all over the world, especially with this COVID crisis. And along with that, we are seeing the mental health issues are on the rise. People are at home, and this has created a lot of tension in a lot of people. So how do you see this issue, and why do you always say that prevention is very important in healthcare, and that is what people should look into?
Well, thank you very much, Harpreet, and it is both a pleasure and an honor to join you tonight on this show. Always appreciate this opportunity to get together with you, very learned gentlemen, on these subjects. We are in a remarkable time in British Columbia, Canada, and world history, where we are dealing with this remarkable novel pandemic. We haven't seen anything quite like this in the world before. I know at a strategic planning session a couple of years ago, one of the suggested scenarios was an epidemic that brought the nation to a halt, and of course everyone kind of laughed that scenario out of the room as, oh, that'll never happen. Well, indeed, that is what we're seeing today. So this is a tough time in our history. It's been very, very difficult for families. They've been separated often from their elders, and we're coming into the worst of it in the holiday season ahead. Again, everybody loves to get together with their families at this time of year, but sadly, we're going to be prevented from doing that by this really terrible pandemic that coincidentally is peaking in its second wave, at least just about the same time as the days are shortest in the year, and we're entering the holiday season where people really want to get together. So this is a tough time for all. We've learned lots from the pandemic.
Mhm.
On the prevention side, I think what we've learned is that those people, those patients who have chronic conditions or chronic diseases are proving most vulnerable to the impact of COVID-19.
Mhm.
COVID goes after flourishes in human bodies that are subject to chronic conditions. So again, it goes back to how do we prevent, how do we remediate, at least as much as we can, chronic conditions like diabetes, hypertension, from appearing in the first instance.
Absolutely, you're very true. That's the most important issue right now is the way this pandemic has affected all of us, which nobody could have even dreamt of. And but this is now not being controlled still until the vaccine comes. Nevertheless, the major issue that we are going to focus today is we always talk about how integrative medicine can play an important role. So, Dr. Garg, over to you. You always talk about how we can adopt integrative approach towards medicine. If there's any question you would like to ask Mr. Abbott.
Yeah, very much so. So, George, as you know, I've been in practice for many years, and most of my training is in Vancouver, University of British Columbia, and I think our emphasis always is very isolated and very focused on a particular disease rather than holistic approach. So I think COVID has shown us that we need to broaden that horizon. So I'd be very interested in finding out from your perspective why we have such a challenge in prevention, why there isn't more emphasis and more direct approach to prevention as part of chronic diseases, but more important is why we are so focused on acute interventions rather than empowering the individual. And that's what integrative medicine is, where you are bringing the individual as a whole and taking the best of what is Western medicine has to offer and what Eastern philosophies have talked about. And I think that's a win-win situation. And COVID has shown that that's what is missing. That's what the challenge. So we'll be very interested to hear from your perspective on it, George.
Mhm. Well, thank you, and that's really an excellent question, Aaron, and I'll do my best to provide a good answer to that excellent question. So I had the honor of being a health minister in British Columbia for 4 years, 2005 to 2009, and 4 years is actually a long tenure for a health minister. I think on average in Canada, health ministers last about 18 months. So I was around the file for quite some time. One of the things after 4 years I came away with was, first of all, a kind of pessimism about solving a lot of the problems that plague the healthcare system, but also a belief that team-based primary care and prevention in particular were the keys to somehow having a sustainable, viable healthcare system into the future. I think, after having lived the role for 4 years, I understand why there is a great emphasis on the acute care system, hospitals, diagnostics, pharmaceuticals, the immediate response to the challenges. It's because from a media perspective, acute care system gets most of the attention. If somebody waits too long in the emergency department, as they sometimes did during my tenure, it became a big issue in the newspapers, on television, and so on. And so, the direction I got from government and the direction within the ministry itself was find a way to shorten up wait times in emergency departments, find ways to improve the timeliness of hip and knee replacement procedures, all of the other procedures that are done in acute care. Because again, I think the reason why we focus on it so much is because that's where a lot of the heat in the system is derived from. And it's also why I think, and I'd form this conclusion again based on 4 years, when the system is under pressure, when the Minister of Health is instructed by Treasury Board to find $200 million in savings or $1 billion in savings, often the prevention initiatives are the first thing that are pushed off the table, because one of the last things you want to do is close a hospital. That's extremely difficult to do. The acute care system is very much something that dominates our thought, and that's why I think the way it is. Should it be that way? No, because I was often told 80% of the demand in the acute care system is driven by people with multiple chronic diseases, combinations of, or chronic diseases and conditions, I should say. So diabetes, hypertension, conditions, obesity, there's a whole bunch of precursors to the event that will bring someone into the acute care system, often via the emergency department because of a heart attack or a stroke or other conditions. Trying to address those things before they appear at acute care should, I think, be more of an emphasis in the system. And I think the system's trying to move that way, but it's very tough. It's a challenging piece because, again, our attention is devoted to the day-to-day issues in the acute care sector.
Mm-hmm. Absolutely.
You're absolutely right.
Right.
Sorry.
Sorry, Dr. Garg. It's time for a short break. We'll go for a break. We'll be back. And from here only, we like to continue because that's a very important, valid point what you have touched, Mr. Abbott, because right now still the waiting times are still high. So is just pumping in the money by the government the answer to all this, or what needs to be done? We'll focus on this aspect also. And of course, your book, which has delved in details about some of these issues, we'll talk about that also after the short break. So we'll be shortly back and we'll continue with our discussion. Shine Family Dental Clinic Dr. Harpreet Singh ਦੀ ਦੇਖਰੇਖ ਹੇਠ ਆਧੁਨਿਕ ਮਸ਼ੀਨਾਂ ਦੀ ਵਰਤੋਂ ਨਾਲ ਤੁਹਾਡੇ ਦੰਦਾਂ ਦੀ ਸਹੀ ਕੇਅਰ ਕਰਦੇ ਹਨ। ਇਹਨਾਂ ਦੀ ਸੇਵਾਵਾਂ ਵਿੱਚ ਦੰਦਾਂ ਨੂੰ ਸਾਫ਼ ਕਰਨਾ, ਕਰਾਊਨਸ, ਬ੍ਰਿਜਸ, ਡੈਂਟਲ ਇੰਪਲਾਂਟਸ, ਰੂਟ ਕਨਾਲ, ਡੈਂਚਰਸ, ਬੌਂਡਿੰਗ ਅਤੇ ਵਨੀਰਸ, ਐਕਸਟ੍ਰੈਕਸ਼ਨਸ, ਬੋਨ ਗ੍ਰੈਫਟਿੰਗ ਆਦਿ ਸ਼ਾਮਲ ਹਨ। ਬੱਚਿਆਂ ਦੀ ਡੈਂਟਿਸਟਰੀ ਦੇ ਵੀ ਮਾਹਰ ਹਨ। ਇਹ ਇੰਸ਼ੋਰੈਂਸ ਕੰਪਨੀਆਂ ਨੂੰ ਡਾਇਰੈਕਟਲੀ ਬਿੱਲ ਭੇਜਦੇ ਹਨ ਤੇ ਤੁਹਾਨੂੰ ਘੱਟ ਤੋਂ ਘੱਟ ਚਾਰਜ ਕਰਨ ਦਾ ਵਾਅਦਾ ਕਰਦੇ ਹਨ। ਫॉर ਸਪੈਸ਼ਲ ਸ਼ਾਈਨ ਐਂਡ ਸਮਾਈਲ 604 503 03 20 ਤੇ ਕਾਲ ਕਰੋ। ਕਿੰਗ ਜਾਰਜ ਸੁਪਰ ਸਟੋਰ ਦੇ ਕੋਲ, ਯੂਨਿਟ 370 7488 ਕਿੰਗ ਜਾਰਜ ਬੁਲੇਵਾਰਡ, ਸਰੀ।
ਕੁਦਰਤ ਦੇ ਸੌਮਿਆਂ ਦੀ ਵਰਤੋਂ ਆਯੁਰਵੇਦਾ ਰਾਹੀਂ 5000 ਸਾਲਾਂ ਤੋਂ ਚੱਲਦੀ ਆ ਰਹੀ ਹੈ ਤੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਹੀ ਬਣਾਏ ਗਏ ਹੈਲਥ ਕੈਨੇਡਾ ਵੱਲੋਂ ਅਪਰੂਵਡ 100% ਸ਼ੁੱਧ ਆਯੁਰਵੈਦਿਕ ਡਾਇਟਰੀ ਸਪਲੀਮੈਂਟਸ ਦਾ ਲਾਭ ਲੈ ਸਕਦੇ ਹੋ। ਸਟ੍ਰੈਸ, ਐਂਗਜ਼ਾਇਟੀ, ਇਨਸੋਮਨੀਆ, ਬਲੱਡ ਸ਼ੂਗਰ, ਕਿਡਨੀ, ਬਲੈਡਰ, ਹਾਜ਼ਮਾ, ਆਈਸਾਈਟ ਜਾਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਬਿਮਾਰੀ ਦਾ ਆਰਗੈਨਿਕ ਇਲਾਜ, ਜੋੜਾਂ ਦੀਆਂ ਦਰਦਾਂ ਤੇ ਸਰੀਰਕ ਮਸਾਜ ਲਈ ਕਈ ਕਿਸਮ ਦੇ ਆਯੁਰਵੈਦਿਕ ਤੇਲ ਵੀ ਉਪਲਬਧ ਹਨ। ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਲਈ ਕਾਲ 604 628 2003।
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਐਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
Once again, welcome back to the program. In this special edition today, we are talking to George Abbott, former Health Minister of British Columbia, and Dr. Arun Garg, who is my co-host today in this collaborative program, which we bring every month. Our focus is always as to how prevention can play a very important role in having better health system. And that's what we'll be talking in details with Mr. Abbott also soon. But before that, just some of our sponsors with whose support every evening from 7 p.m. onwards Pacific Standard Time you watch this program live. This program has been brought to you with the support of AMC Insurance. If you're looking for home, auto, travel, business, life or recreational insurance, they have 9 branches in the Lower Mainland to serve you, and they're open 7 days a week from 8:30 a.m. onwards till 9 p.m. For more information, call 604-507-6666. Our next supporter is Ahi Transportation Group. They have been in the transportation and storage industry since 1993, and the motto is "Your cargo is our responsibility." So if you're planning to send your goods anywhere in Canada, you can depend upon them. Phone number is 604-940-9511 and address is 8970 River Road, Delta. Let's get back both our guests and continue with our discussion. So Mr. Abbott, before the break, the point what you touched was, and my question to you is just pumping in the money by the government the only panacea to all this what is existing right now? And what do you feel are the major challenges that need to be looked into, not just by the government, but also by the people also?
Well, I do think always money comes into question, and it would be tough for me to deny that. I think when I was health minister, I was fortunate to be health minister at a time when we had, at least between 05 and 09, a strong economy. It faded before that and it faded after that, but there was lots of dollars flowing, and I enjoyed annual increases of 6 to 7%. Often close to $1 billion a year, every year that I was health minister. So we were able to do some great stuff as a consequence of additional dollars coming into the system. Now, that said, it's also about organization. It's also about priorities. I do like the current NDP government's emphasis on urgent care centers as a way to move some of the demand that sometimes is heavy in emergency departments, moving that out to a little bit more relaxed setting of urgent care. I think one of the goals we wanted to achieve, even as far back as 05-09 as well, is team-based primary care and sometimes group care, where we take less dependence on physicians. Physicians are still at the center of the system and very critical, but supporting them with teams of nurses, physiotherapists, pharmacists, dietitians, and so on, and trying to bring people together either individually or in group sessions to say, we understand that you're struggling with potentially with diabetes or have type 2 diabetes. Here are some things we can do. We've got a dietitian here who will give you some great advice on a diet that will help you reduce weight and try to help you to fight diabetes. We've got a pharmacist here who can give you the best advice on that. So in team-based care, you de-emphasize the physician to some extent, and you round out the group with other skills that can be brought to the table. So I'm a big believer in that. I'm a big believer in what is now known as virtual care, where we use electronics to connect up people sometimes in rural and remote areas with physicians or other healthcare providers. But what we've seen and what we've learned from the experience of COVID-19, and we've been forced to do it because of COVID-19, is that we can do many of the consults between physicians, specialists, and patients through electronic medium, rather than having always to have them face to face. So I think that may be something that's going to be changing our healthcare into the future. It certainly make a big difference for rural, remote BC, but I think also for the system generally.
Dr. Garg, would you like to add on to it?
Yeah, no, I think this is absolutely in the right direction, George. And I think it'll be a shame if we don't learn from COVID. So when we were talking about team-based, and I was talking about integrative approach to health and the gap, that's exactly where we have to work. I agree that acute care is too important, too emotional, and that that service will continue, and it's not the issue of one or the other, but through innovation we need to add more. And the place where we need to add is what you were describing. Different people describe it differently, but to me that is an example of integrative medicine. What you're doing is you're looking at the gap and you're filling it where maximum impact will happen. So I think it is doable, and hope and I think this particular present government has really done some very good things in healthcare. And I think through programs like these and through reaching out, and it's the people who are asking George more that yes, help us in having self-management, having us more engaged. And I think this is where we need to go. And I think hopefully minister is listening, and then hopefully we get some play on it, but I'm not counting. But I think this is important. And I think chronic care and diabetes through team-based approach and the gap. And the nice thing about integrative medicine, and maybe we could talk a little bit about it before we go into the book, is that it brings the person right on. And we talk about organs, or we talk about specific systems, but we don't include the role mind plays in illness or in health. And I think emphasis through mindfulness, emphasis through integrative approach of playing the role of mind enhances that. And I think with your experience in Aboriginal communities and indigenous communities, I think one hears this all the time, the concept of wellness and the concept of self-control. And I think we could learn from those things as we go forward. So hopefully
Right.
COVID will give us that opportunity.
Yeah. And Mr. Abbott, what is your approach towards holistic health, patient self-management, empowering the people so that they become the masters of their own health and just don't depend upon the services that are provided?
I agree entirely with Arun on the holistic integrative piece. And again, I'll start with this observation from our current experience with COVID-19, and that is that for the approximately 20% of British Columbians who suffer some form of mental health challenge. It may be something as simple as anxiety, maybe bipolar disorder, but about 1 in 5 people in the province will suffer some form of mental illness. What I've seen and what I've sort of detected personally in this period, last 9 months, is that COVID, because of the social isolation that is a part of COVID, that those mental health challenges tend to get elevated and amplified by social isolation. And so I think there's an important lesson there that when we get the vaccine, when we move on to a post-pandemic world, I think we need to start thinking very much in the terms that Arun has set out, where we look at the whole person, where we look at not just the body, but the health of the mind in that case as well. And I think that's really one of the really important pieces in the future of medicine and prevention particularly, is dealing with the whole person, looking holistically at the challenges a person may face, but having that person learn not only from the medical professionals and doctors, nurses, pharmacists, dietitians, and so on, but also learning from other patients. What were the psychological tools that they used to help them deal with a weight issue, or a substance abuse issue, or any other issue that's reflective of a mental health challenge. So looking at the whole person, couldn't agree more. We need to do the same thing on fighting climate change. We need to take lessons from the health world, apply them to climate science, apply them to education, and vice versa. It's very much an integrative puzzle that we have. And the sooner we start looking at it in an integrative way, I think the stronger the system will be.
Great. It's time again for a short break, but after the break, when we come back, we'll be talking about this beautiful book, Big Promises, Small Government, and doing less with less in the BC Liberal New Era. This book is becoming quite a sensation. We'll be talking a little bit about this. But after I come back, Mr. Abbott, I would like to know from you as to what do you feel, what insight would you like to give us about why Canada and India are at odds, why they have not been able to reach their potential, the best of the West and the wisdom of the East. Why is it that we are not being able to take that into the health sector? We'll talk about this after this short break.
Karen thought she won a gift card, but we had a much bigger surprise for her. We rise by lifting others. Basant Motors.
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ, ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ।
ਦਰਦ ਤੋਂ ਆਰਾਮ ਐਲੋਪੈਥਿਕ ਦਵਾਈਆਂ ਖਾਣ ਨਾਲ ਆ ਤਾਂ ਜਾਂਦਾ ਹੈ, ਪਰ ਇਸ ਦੇ ਸਾਈਡ ਇਫੈਕਟਸ ਵੀ ਹੁੰਦੇ ਹਨ। ਨੈਚੁਰਲ ਤਰੀਕੇ ਦੇ ਸਪਲੀਮੈਂਟਸ ਨਾਲ ਤੁਹਾਡੀ ਦਰਦ ਨੂੰ ਜੜੋਂ ਖਤਮ ਕਰਨ ਵਿੱਚ ਮਾਰਕਸ ਫਾਰਮੇਸੀ ਦੇ ਹਿੰਦੀ ਪੰਜਾਬੀ ਬੋਲਣ ਵਾਲੇ ਸਟਾਫ ਤੁਹਾਡੀ ਮਦਦ ਕਰ ਸਕਦੇ ਹਨ। ਇਹ ਆਪਣੇ ਪ੍ਰੋਡਕਟਸ ਕੈਨੇਡਾ ਦੇ ਹਰ ਹਿੱਸੇ ਵਿੱਚ ਵੀ ਭੇਜਦੇ ਹਨ। ਅਪਾਇੰਟਮੈਂਟ ਬੁੱਕ ਕਰਨ ਲਈ ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ 604 596 1774 ਜਾਂ ਫਿਰ ਵਿਜ਼ਿਟ ਕਰੋ 8035 120 ਸਟਰੀਟ ਡੈਲਟਾ। ਦਰਦ ਨੂੰ ਜੜੋਂ ਖਤਮ ਕਰੋ। Once again, welcome back to the program. Mr. George Abbott and Dr. Arun are our guests today, and we are talking about how we need to focus more on prevention. And as before the break, we were talking with Mr. Abbott, and he raised some very pertinent points as to why there is a need for adopting the integrative approach. And just recently, he's written a book, Big Promises, Small Government. So we'll learn from him about what all he has tried to talk about in this book. And as I said, it's become a very major sensation. He has a long experience of being a health minister in British Columbia. So let's get back to him and let's continue with the discussion with the question which I raised before the break as to why he feels India and Canada have not yet reached their potential as far as health is concerned. Yes, Mr. Abbott.
So a really interesting question, and one I think we've probably made some progress on, but we've got a long ways to go in terms of maximizing the value that can come from better understanding the huge contribution that India has made to medicine. I think the core of the problem is that if we look back 50 years, the emphasis was almost entirely on the physical side of the human. Our preoccupation was with providing services to deal with immediate problems. If I had broken my arm, I go into emergency, I get it casted, away I go, everything's wonderful. If I had a cancer, it's operable, they operate, and again, all good and a wonderful part. But there was always a kind of prejudice is too strong a word, but discouragement of mental health issues. Healthcare providers were uncomfortable dealing with mental health issues. They weren't funded by the healthcare system to provide emotional counseling, that sort of thing. So I think there was that resistance because, fixing my arm after it's been broken is fairly straightforward. Helping to solve my issues around anxiety are more complex, more time consuming, and you don't have the same product in the same fixed time frame that you would with a physical ailment. So I think we've turned a corner on that. There was a very good report by the Senate of Canada on mental health issues now a couple of decades ago. And Out of the Shadows was the name of the report. Very important in starting to see a shift in our healthcare system where we are thinking more about the psychological health, mental health, as well as physical health of the patients served. So that's I hope where our starting point is as we look at the future, because we clearly need to do much more in that realm. The important causal links between mental health, psychological health, and physical health are all there. And Ontario's done some good work recently on funding consultations for lifestyle, for diet, and I think that's one that BC could emulate, and hopefully we see additional resources going in that area. That's, I think, a very important area for the future in BC.
Over to you, Dr. Garg. Regarding the book, you have read a little bit about the book. And first you have a question with the former minister, and then I would like to continue with the heading that he has brought with. Big promises, small government. And this is a normal norm.
Yeah.
Before the elections, a lot of promises are made. So we'll talk to him about what made him have this title. But before that, Dr. Garg.
Thank you, Harpreet ji. So, George, this is a fantastic book. I mean, I've known you for many years, but I never thought that you, among other talents, so many talents, you're also a fantastic writer. So I read it, I couldn't put it down. And I will recommend this to anybody who is interested in learning the public policy from a very experienced observation. My question is, it is a very honest book. I think you really bring out the the issues in a very honest way. So one of the areas I was really struck was, and I haven't seen this in books written by former politicians, is the British Columbia. Recognition that British Columbia is really a very small economy. And you say that British Columbia, in the book, you say that British Columbia GNP is less than 1% of total North American GNP. And I think we need to keep that in mind in our policies in terms of relationships, export, trade, and all that. So I was intrigued by that. So maybe you could explore a little bit further, because we need the world more than world needs us. And that clearly shows by that data. So what was behind that, and what do you think we could do in British Columbia to overcome that and prosper?
Yeah, well, thank you for the question. I think the book is I hope a really interesting combination of history, politics, and public policy. Those are the three things that I kind of blend in that book, because I think all three are really important to understanding what occurred between 2001 and 2005, which is the focus of the book. Why things occurred the way they did, where did the ideas come from, how did they evolve in the circumstances of BC. So lots of the ideas came from places, not just Alberta and Ontario, but New Zealand, Great Britain, and other jurisdictions. There were ideas around the efficacy of tax cuts that really drove much of the public policy during the period in question. And the belief was that if government cut taxes, and this comes also from the Ronald Reagan era in the United States, and most recently the Donald Trump era in the United States, the belief that if you cut taxes you stimulate the economy, and any losses of tax revenue would be made up by the additional economic growth that would occur and the taxes that would flow from that additional growth. As it turned out, if a jurisdiction cuts taxes at a time when they are experiencing very strong economic growth, to some extent that growth will compensate for the loss of revenues. But if it occurs at a time, as it did in BC around 2001, where the economy was flattening out, there was very little growth, in those circumstances, what it meant when we cut taxes by 25% was that we were creating an over $2 billion hole in the budget. And because the economy was not growing, tax cuts weren't paying for themselves, we ended up in a situation where different ministries, including mine and Children and Family Development, Human Resources, the social ministries, in fact, all the ministries except for Health and Education that were protected, they all had to find what ended up being a $4.4 billion shortfall. It's a tough story to read in lots of ways.
Mm-hmm.
Tough story to read in lots of ways, but it's an important one, I think, for understanding policy.
So, Mr. Abbott, how did you come up with this title, Big Promises, Small Government? Was it a wow moment, or you went for a lot of titles but finally settled on this? What was behind this title?
Sure. The point I was attempting to make with the title is first of all, when we look back at 2001 and at the BC Liberal platform, it's called the New Era document in short. But that 2001 platform did not indicate that a BC Liberal government would drive for smaller government. The indication in the New Era document was, and it was exemplified in over 200 commitments, probably costing $2 billion or more in total. Those big promises, those $2 billion in commitments, some of which landed in my ministry of Community Aboriginal Women's Services, we had to find the dollars to fulfill those New Era commitments, at the same time dealing with the shortfall from the tax cut, and then magically trying to make all that work by February of 2004, when we were expected to have a balanced budget. So, big promises, small government, the two did not mesh well in my argument. Right. And that's why we ended up living with less for this period in terms of budgets and services and so on.
Okay. Well, just to discuss this book, I think we'll have to do a separate program because time does not permit me. Time just flies over here, Dr. Garg, as you always say. There's so much to talk and so much of wisdom what we have with Mr. Abbott today. And nevertheless, in the just about 2 minutes what I have, Mr. Abbott, from being a politician and now seeing what is happening all over, if you have to sum it up, what would be your message today to our viewers who are watching this program?
Well, I think my message would be we've got to learn important lessons from this very difficult time in our lives, COVID-19. And I think the big lessons are that we need to look at life, we need to look at government services much more holistically. We need to be thinking about the prevention side, we need to think about the rebuilding better side, we need to think about services holistically, not just the response or the acute care or putting the fire out. We need to think about what's the cause of the fire, how can we prevent its spread, all of those things. So it's a different view of the world, and I think we can learn an enormous amount from the Indian experience, both the Indian experience in Asia, but also the Indigenous experience in Canada, as we think about these issues much more holistically than we have in the past.
And Dr. Garg, to sum it up, what would you like to say?
No, thank you very much again, George. And I think, personally, I think we can make the change. And I think it's the effort like yours, like your op-ed in province, your work with the Institute of Healthcare System, and the ongoing sharing of the knowledge and working with policymakers, I think will bring the change. But I think we need to be focused, and we need to be going where the real gaps are. And I think that is the real thing which has been missing. And we continue to have acute care. We continue to respond to the need of the society in acute care, but we need to work towards these gaps. And I think it will happen. And we cannot let COVID go and not learn from it. I think this is a crisis which need to be turned into opportunities. And thank you very much for doing great service through your work, volunteer work, and many boards and committees. So thank you.
Thank you, gentlemen.
Well, thank
both
you.
of
It's been a
Before I
real
let
honor and a
Mr.
pleasure to
Abbott
be
let
with
you
you.
go, if somebody wants to get a copy of this book, Big Promises, Small Government, where can they get a copy of this book?
They can go to ubcpress.ca, ubcpress.ca, and they can enjoy a copy of Big Promises, Small Government at a 30% discount until December 31st at that email address.
Great. Thank you very much once again for sparing your valuable time and being a part of this program. Thanks, and we hope to have you back soon. After I read this book, then we will grill you on some of the things what you have written in this.
Great.
Thanks once again.
Yeah, real pleasure and honor to be here. Thank you.
Thank you, Dr.
Thank you. Thank you. Thanks, George.
ਸੋ ਇਹ ਸਨ ਸਾਡੇ ਮਹਿਮਾਨ ਜਾਰਜ ਐਬਟ ਅਤੇ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਜਿਨ੍ਹਾਂ ਨਾਲ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਕਿ ਪ੍ਰੀਵੈਂਸ਼ਨ ਕਿਉਂ ਜ਼ਰੂਰੀ ਹੈ ਅੱਜ ਜਿਹੜਾ ਕ੍ਰਾਈਸਿਸ ਹੈਗਾ ਕੋਵਿਡ ਦਾ ਅਸੀਂ ਦੇਖ ਰਹੇ ਹਾਂ ਕਿ ਬਹੁਤ ਵੱਡੀ ਸਮੱਸਿਆ ਬਣੀ ਪਈ ਹੈ ਪਰ ਇਸ ਨਾਲ ਜਿਸ ਤਰ੍ਹਾਂ ਮਿਸਟਰ ਐਬਟ ਨੇ ਵੀ ਕਿਹਾ ਕਿ ਇੱਕ ਹੋਲਿਸਟਿਕ ਅਪਰੋਚ ਜਿਹੜੀ ਹੈਗੀ ਉਹ ਲੈਣੀ ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ ਸਾਨੂੰ ਆਪ ਵੀ ਇਨੀਸ਼ੀਏਟਿਵ ਲੈਣਾ ਪਏਗਾ ਆਪਣੇ ਸਿਹਤ ਦੇ ਜ਼ਿੰਮੇਵਾਰ ਆਪ ਹੀ ਬਣਨਾ ਪਏਗਾ So prevention is better than cure. We have always been saying that, but right now is the time when we need to incorporate that into our daily life also. And this is what this program always focuses on. किस तरह ਅਸੀਂ ਚੰਗਾ ਖਾਣਾ ਖਾਣਾ ਹੈ ਕਿਸ ਤਰ੍ਹਾਂ ਆਪਣੇ ਆਪ ਨੂੰ ਐਕਸਰਸਾਈਜ਼ ਕਰਕੇ ਸਿਹਤਮੰਦ ਰੱਖਣਾ ਹੈ ਕਿਸ ਤਰ੍ਹਾਂ ਆਲਾ ਦੁਆਲਾ ਮਾਨਸਿਕ ਤੌਰ ਤੇ ਸਰੀਰਕ ਤੌਰ ਤੇ ਅਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਮਜ਼ਬੂਤ ਬਣਾਉਣਾ ਹੈ थोड़ा मेरा साथ होया करता है मंडे टू फ्राइडे शाम के 7 बजे पैसिफिक स्टैंडर्ड टाइम के मुताबिक एंड इन दिस प्रोग्राम एवरी डे वी हैव डिफरेंट गेस्ट्स एंड वी टॉक अबाउट डिफरेंट इशूज़ द आइडिया इज़ टू इंस्पायर यू टू एजुकेट you and to empower you. So if you also want to be a part of this program, you can contact me at 604-603-7555 or you can email me at harpreetsinghshow@gmail.com. ਇਸ ਨਾਲ ਹੀ ਲੈਣਾ ਆ ਗਿਆ ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ ਕੱਲ ਸ਼ਾਮ ਨੂੰ ਇੱਕ ਨਵੇਂ ਮੁੱਦੇ ਨਾਲ ਇੱਕ ਨਵੇਂ ਇਸ਼ੂ ਨਾਲ ਤਦ ਤੱਕ ਦੁਆ ਗਿਆ ਹੈਵ ਅ ਸੇਫ ਈਵਨਿੰਗ ਸਟੇ ਹੈਲਦੀ ਐਂਡ ਇੰਜੋਏ yourself.
ਭਾਰਤ ਪੈਸੇ ਭੇਜਣੇ ਹੋਣ ਜਾਂ ਫਿਰ ਮੰਗਵਾਉਣੇ ਹੋਣ ਤੇ ਯਾਦ ਰੱਖੋ ਪੰਜਾਬ ਫੋਰੈਕਸ ਨੂੰ ਤਸੱਲੀ ਬਖਸ਼ ਸੇਵਾਵਾਂ ਅਤੇ ਵਧੀਆ ਰੇਟ ਦੇਣ ਦੀ ਇਹ ਗਾਰੰਟੀ ਕਰਦੇ ਹਨ ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ 6043491313 ਉੱਤੇ
ਲੈਣਾ ਚਾਹੁੰਦੇ ਹੋ ਨਵੇਂ ਤੇ ਵਧੀਆ ਅਪਲਾਈਐਂਸਸ ਜਿਵੇਂ ਕਿ ਸਟੋਵ ਓਵਨ ਫ੍ਰਿਜ ਵਾਸ਼ਰ ਡਰਾਇਰ ਮਾਈਕ੍ਰੋਵੇਵ ਫ੍ਰੀਜ਼ਰਸ ਜਾਂ ਡਿਸ਼ਵਾਸ਼ਰ ਤਾਂ ਫਿਰ ਪਹੁੰਚੋ ਪ੍ਰੀਮੀਅਮ ਅਪਲਾਈਐਂਸਸ ਤੇ ਇਹਨਾਂ ਦੀਆਂ 3 ਬ੍ਰਾਂਚਸ ਸਰੀ ਐਬਟਸਫੋਰਡ ਤੇ ਚਿਲਵੈਕ ਵਿੱਚ ਹਨ ਇੱਥੇ ਤੁਹਾਨੂੰ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਅਪਲਾਈਐਂਸਸ ਮਿਲਣਗੇ ਇਹ ਡਿਲੀਵਰੀ ਤੇ ਇੰਸਟਾਲੇਸ਼ਨ ਵੀ ਕਰਦੇ ਹਨ ਸਪੈਸ਼ਲ ਪੈਕੇजेस ਫॉर ਬਿਲਡਰਸ ਐਂਡ ਹੋਮ ਓਨਰਸ ਕਾਲ 6045904140 604-590-4140 ਵੈਨਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ ਸਟੋਨ ਮਾਰਬਲ ਬੈਕਸਪਲੈਸ਼ ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ ਇਟਾਲੀਅਨ ਸਪੈਨਿਸ਼ ਚਾਈਨੀਜ਼ ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 13042884 ਐਵਨਿਊ ਸਰੀ ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604-330-7363 604-330-7363